I think it's important to sort of pause and reflect a little bit on the numbers that we're dealing with here, because those numbers are so huge, 13 million, and we think that's just the tip of the iceberg for preterm births, as we think 3.2 million for stillbirths is just the tip of the iceberg. And part of that is because a lot of women don't get care in facilities around the world, so we aren't actually counting the way we should be to really understand the absolute magnitude of this. And the other part of the problem is, as you've heard in the video and this morning, is the fact that they're kind of invisible. And until we raise that visibility, we're not going to be counting properly and really understanding, if we do intervene, what the impact would be. Now, preterm birth is the #1 cause of infant mortality around the world. And these are truly global issues. They happen right in our own backyard. And I think that's important to reflect on, because while we think we're doing a great job of actually caring for these children, and we do in certain developed country settings, we still haven't really even begun to approach why it happens and what we could do to actually prevent it. And I think an important statistic there is that if you add AIDS, TB, and malaria together in terms of under-5 mortality, it still doesn't come close to what happens for those children who die of preterm birth and of stillbirth. So these issues devastate families around the world, and we need to raise the visibility and recognize the fact that even in technically developed countries, 1 in 8 babies are still being born preterm, and that number's gone up 38% since 1981. And the striking thing are the disparities that also exist. Right now, African Americans in this country almost see twice as much preterm birth as whites and Asians. And Native Americans are just under the African American rate of 18.4%. And we don't have a clear idea of why this happens. Now, the other important element here is the United Nations Millennium Development Goals, Millennium Development Goal 4 and 5, on reducing both child mortality under 5 and maternal mortality by 2015. And it's clear that the major component now of under 5 mortality is neonatal death. And because maternal health and neonatal health are integrally linked, we need to work on both of these at the same time to have an impact by 2015. So we think a lot can be done, and we think that there's hope. And I think if anything that we impart on all of you today is that despite the magnitude of the problem, there are ways that we can actually get at these important health issues. We need to understand the biology of pregnancy. As a scientist, I can tell you it's rather embarrassing not to be able to actually explain why a woman delivers her baby at 40 weeks gestation, or why we are focusing on the last 0.5% of pregnancy during labor and delivery to try and understand why women have adverse outcomes of pregnancy, and not study more the other 99.5% of pregnancy that's currently going on. We also need to focus on the interventions that can be done right now that we know work in low and middle income countries, and to use them better and to scale them up better, and also to take those interventions that we know could work in the developing world and implement them there and help scale them up. And so we are really interested in trying to promote that agenda. And the landscape review that you've just heard about actually helped set the stage for the conference we had in Seattle in May 2009. And it was probably the most amazing thing, at least for me personally, to have witnessed and been involved in. We had a major gathering of 200 experts in maternal newborn health from all different disciplines, organizations, and they came with a collective will to work together to come up with what we called the Global Action Agenda. And we really worked them hard. For 2.5 days, they sat in 12 different groups. They worked around the clock, basically, to come up with short, medium, and long-term goals with success metrics that we could use to really begin a global effort here and abroad to make an impact on preterm birth and stillbirth. So the goals of this were to increase awareness and to understand the magnitude better of both preterm birth and stillbirth, close those research gaps that really need to be filled, to support discovery and science and intervention development, and most importantly, how they get delivered effectively around the world, especially in high-impact countries. And finally, to help advocate for increased resources and implementation of what comes out of that science.